Hi, this is Dr. Marty Rossman for The Healing Mind, and I want to talk to you today about a topic that is very difficult for patients and for doctors as well, and that's the topic of chronic fatigue syndrome. And I'm going to want to talk to you about how mind-body medicine, deep relaxation, and guided imagery can be helpful to people with chronic fatigue syndrome. So, chronic fatigue syndrome isn't a single disease. As a matter of fact, it has a myriad of names. It's been known as chronic fatigue syndrome, chronic fatigue immune dysfunction syndrome, eosinophilic myalgia / chronic fatigue syndrome. It typically consists of a deep and disabling fatigue, aching, muscle and joint soreness, inability to sleep, inability to get deep and restorative sleep, brain fog, and difficulty in some cases with cognitive functions, difficulty concentrating. It has a lot of different manifestations, and it is probably, or almost certainly in my experience, not one single disease. We don't know the cause of it. People have been researching this now for about 30 years, although it's one of these syndromes that doctors were uncomfortable with, wasn't really recognized as a legitimate kind of syndrome or illness for many years. Many doctors would write this off as, oh, that person's depressed. We know now there have been studies that while the illness may be depressing, and somebody with chronic fatigue syndrome can certainly also be depressed, it's different than depression. There are many people with chronic fatigue syndrome who are definitely stressed but are not depressed, and it's not the same as depression. Depression doesn't help, and we'll talk about that in a little bit as well. It has stimulated research in areas like hidden viral infections, and many viruses have been studied: cytomegalovirus, various herpes viruses, including herpes virus 6, Epstein-Barr virus, and these may well be implicated, although there have been research projects going on at good institutions like Stanford University and others, where people have been treated with high doses of antiviral drugs over a very long period of time, some of them definitely benefiting and some not. In my experience working with a lot of people with this diagnosis and working with various experts who have been really interested in trying to get to the bottom of this, sometimes it's been found that people have deep reactivated viral flare-ups. This may not be the cause of the illness, but because the immune system is not functioning properly in people with chronic fatigue, it's actually kind of hyperstimulated. And the hyperstimulation is part of the fatigue, just like when you get a common cold and you feel crummy, you feel achy and tired and fatigued and foggy-brained, and you don't feel like doing anything. A lot of those symptoms actually come from the activation of your immune system against the virus or the cold or the infection that you're fighting. And so with chronic fatigue, we think that there's a chronic low-level activation of the immune system, which produces similar symptoms on an ongoing basis. It's often made worse by exercise, and people with chronic fatigue often have reduced exercise tolerance. They want to get out and exercise, and people encourage them to get out and exercise, but when they do, they get setbacks and are more fatigued for a period of time. It's it presents a lot of challenges and a lot of not only physical and illness challenges, but psychological challenges too, because a lot of times people with chronic fatigue syndrome look perfectly normal and there's no visible mark of an illness on them. And yet there are people or friends in their family can't understand why they can't come to every party or why they make plans to go out to lunch or dinner, and then they have to cancel them a lot at the last minute. And people can't rely on their energy and have to parcel it out and are never really sure when they're going to have enough energy to do what they need to do. It can affect their marriages and their relationships, their parenting. And because nobody knows exactly what it is, and many people will write it off to stress. And stress certainly affects it, but it's not just stress. It's a difficult thing for people to cope with. So with the experts that I've worked with over many years, the ones that really try to dig deep, I have seen people recover from chronic fatigue syndrome, but not from one intervention. With some people, it does seem to be reactivated viral illness, but since we're not terribly good yet at treating viruses, most viruses, the therapeutic plan needs to be to find ways to boost the immune response and balance the immune response so that the immune system is working more efficiently and not overreacting to things it doesn't have to overreact to, and being able to suppress these viruses, which normally it keeps in a dormant state. So we look at nutrition and we look at mind-body practices as ways to support the immune system to function in a better way. I've seen people who have been found to have undiscovered Lyme disease and other tick-borne diseases, which are much more common than they're generally recognized. There's a very big medical controversy about Lyme and other tick-borne diseases, with two major professional medical societies kind of at war with each other, one of whom believes that there is no such thing as chronic Lyme disease or chronic tick-borne diseases, which doesn't seem reasonable to me, but they present a certain amount of evidence, and another one which presents a lot of evidence that there are chronic, lingering, smoldering infections, sometimes more than smoldering, that come from untreated infections with organisms that come from tick bites, from Lyme disease to Borrelia to Babesia and Rocky Mountain spotted fever. And these often require very, very long courses of multiple antibiotics. And it's very rigorous and can be very expensive and without guarantee that it will help. But I've seen people get better from that. I've seen other people be worked up by good nutritional doctors and found to have nutritional deficiencies, and we always look for that and work with that. But also, I think toxicity is a very underaddressed aspect of medicine. In general medicine, we rarely look at it, in spite of knowing that there's tens of thousands, even hundreds of thousands of chemicals in the environment that weren't there 100, 125 years ago, that there's a lot of toxins on board that can be not only hormone disruptors, but immune system suppressants and have adverse effects on health. So the medical detective doctors that look deep at chronic fatigue syndrome may look into toxic loads and detoxification programs. I've seen people who have been discovered to have chronic immune activation to mold in their environment, and who have done mold remediation in their house, which can be very expensive, again, risky and no guaranteed results, but where toxic molds have been found. and removed, and the person, again, their immune system is supported and their detoxification systems are supported, where they will improve. And again, have seen people even recover from chronic fatigue. But these investigations are often not done by conventional medical doctors. They may be done by integrative medical doctors. They may be done by good naturopathic doctors, some nutritionists and other health professions that are highly educated and deeply involved in nutrition, in allergy and immunology, and mold toxicity and chemical toxicity, and so on. So these are some of the challenges for the patients, because they can go down a lot of rabbit holes with no guarantees, often not covered by insurance. So these things are very stressful, along with the stress of the illness, the financial, the economic, the social stresses, the mental worrying about whether I'm causing this, whether I'm making this up. These all compound on each other. And I do a lot of work supporting people with chronic fatigue syndrome, and just helping to support them mentally, emotionally, psychologically, and spiritually, as well as helping them find resources to thoroughly investigate them medically, nutritionally, and toxicologically. It's a tough word. So I mentioned one of the challenges is that people often look well, but they are frequently ill and can't meet their obligations. When we talk about mind-body interventions that can help people with chronic fatigue, something I want to make clear is that if you find that utilizing mind-body tools, from deep relaxation to guided imagery to hypnosis to meditation, helps you, it doesn't mean that you created this illness in your mind. So a lot of times I've found that people with chronic fatigue syndrome are hesitant to get involved with mind-body tools, because they feel there's the implication that if I help myself with my mind, does that mean I created this or caused this with my mind? If I can help myself with guided imagery and imagination, does this mean that I've created this in my imagination? And it doesn't mean that at all. Just because you can help to fix something with a set of mental tools does not mean that you created something consciously or unconsciously with your imagination or with your mind. So free yourself from that concern. And if you haven't investigated mind-body tools, I think you should, because you'll find them very useful. The very first one, of course, is deep relaxation, and that's kind of counterintuitive. People may say, I already feel tired all the time. Why would I go into a deep relaxed state? Why would I take the time I've got when I have some energy and put it into going into a deep relaxed state? And the answer to that is that when you learn to enter that deep relaxation state, again, we call it the relaxation response or the rest and digest response, the opposite to the stress, to the fight, flight, and freeze response, it does free up your body and mind to do things that are reparative and balancing and recharging and renewing in the system. It takes the body out of the worry, which there's a lot of when you have chronic fatigue syndrome, and it allows the body and mind to do what it knows how to do in terms of replacing nutrients, recharging cells, building up their energy-producing capacity, balancing the immune system, balancing the digestion, relaxing the muscles, reducing inflammation. So if you haven't learned how to do a deep relaxation, I strongly suggest that you learn how to do that. And I'll mention some of the resources that I've made available And there are many other resources for learning deep relaxation. It is a facilitated healing state. And if you can put yourself into that state for 15 or 20 minutes once a day, wonderful. Twice a day, even better. If you're up at night and you can't sleep, that's one good time to do deep relaxation techniques, because you'll at least rest and recharge. You may fall asleep. That's fine. You'll be happy if that happens. If not, at least you'll be recharging and resting on many levels, as opposed to staying up and fretting and worrying about what a wreck you're going to be the next day. So try to do that at least once a day, preferably twice, and try to do that for about 3 weeks and see how that affects you. There are many other guided imagery techniques, ranging from visualization or direct imagery of how you would be if you were better, how healing would happen in your body, and visualization or mind-body imagery, mental imagery, for many people can relieve pain, can help us sleep, can relieve inflammation, can help us feel better about ourselves. And then there are some very fascinating and very useful receptive imagery techniques where you really go into a deep state and inquire of your body or your unconscious mind, what else might I be able to do to support you in your healing? And some of the tools I'm going to mention to you, I offer very careful instruction in that. The main thing in doing those techniques, if you're listening to your body or working with an inner wisdom figure to see what you can learn about how you might be able to help yourself heal, is that you do this without judgment. The purpose is not ever to blame yourself, even if you find that there's something that you've done that's contributed to the poor state of health, overworking, workaholisms, overstressing, overworrying, whatever you find, that's already done. There's no reason to blame yourself or to spend a lot of mental energy with that. The idea is, okay, what can I do now to reverse that? What can I do now to provide the nutrients, the materials, the time, the space, the energy, the intention to support the healing that my body, mind, spirit can do? That's always our focus and always our intention. So if you're interested in exploring mind-body techniques to support healing, I'll encourage you to go to thehealingmind.org, thehealingmind.org. There's a lot of resources and tools there. The programs I would probably suggest that you take the closest look at are my program called Guided Imagery for Self-Healing, which is a book and a set of audios that you can get either in CD form or download. The book explains why this approach makes sense. It has the science behind it. It tells you how and where it's being used at all of the major medical universities in this country and internationally. And it teaches you the 9 or so fundamental and important guided imagery skills that you can put to use on your own behalf. And it gives you the scripts if you want to record your own guided imagery, but it's much easier to download or get the CDs that I've recorded to lead you through each of the techniques that's described in the book. And in that sense, my goal with that was to provide kind of a home study course. It's inexpensive. It's the equivalent of working thousands of dollars of working with an individual guide, whether it be me or some of the hundreds of health professionals that I've trained with my partner at the Academy for Guided Imagery. It can give you a leg up then if you want to work with a professional after that. There's really a ton of instruction for both the right brain and the left brain in that course. The other course you might be interested in, if you find that you're a worrier and that you can't get out of a worry groove, is my online course, The Worry Solution, or my book in, again, audio set called The Worry Solution. Take a look at both of those, and you can always try them out. I have a 90-day guarantee on all of my courses. If you don't find them useful, we'll refund your money, no questions asked. So you don't have anything to lose except some time and attention, which are precious, a small amount of money, which we will refund if it's not useful to you. And I really encourage you, I know if you have chronic fatigue syndrome, you've put in a lot of time, a lot of money, a lot of frustration, seeing lots of professionals, and I don't discourage you from doing that. I encourage you to keep searching, but also I want you to take some time to search in the inner world, because your body and your unconscious has a lot more wisdom about health than our conscious minds do. And I'd like to teach you how to access that and use it for your own well-being. So, thanks for listening. This is Dr. Marty Rossman for The Healing Mind, wishing you better health.